The axial skeleton includes essentially the axis of the body. So it goes from the head all the way down the spine, way down here to the sacrum and the coccyx. Okay, it also is going to include the ribs. If we wrap around here, we can also see the sternum. All right, so we'll start here. The sternum is broken into 1, 2, and 3 parts. The manubrium is this right here, the body of the sternum, and way down here, this is the xiphoid process. These clear structures here are the costal cartilages, and they allow your thoracic cavity to expand and retract when you breathe. You have 12 pairs of ribs. The first 7, 1, 2, 3, 4, 5, 6, and 7, all have their own individual costal cartilage attaching to the manubrium, or to the sternum on the anterior thoracic. The remaining 5 pairs of ribs are called false ribs. Right, so 1, 2, and 3. All right, so this is 8, 9, and 10. These all share a costal cartilage, right, to ultimately attach again to the sternum. Now the final 2 ribs, we wrap around to the back, we see have no costal cartilages. Right? These are specifically called the floating ribs, so they are pairs 11 and 12. We can see that all of the ribs attach to the spine. Now the spine is divided into 3 different regions. The first 7 vertebrae are called cervical. So 1, 2, 3, 4, 5, 6, and 7. Okay. This next rib attaches to the first pair of this next vertebra attaches to the first pair of ribs. So this is the thoracic spine. There are 12 vertebrae in the thoracic spine. 1, 2, 3, 4, and all the way down to this last pair here. Now we can name these vertebrae according to their position. Okay, so this one is C1, cervical 1, C2, cervical 2, and so on and so forth. T1 through T12. And finally, the final 5 ribs are lumbar. So L5, L4, L3, L2, and L1. Okay. When the spine is articulated, that is when the spine is joined together by joints, which we'll talk about later, it forms a canal, which we can see on this model as the metal. Right, so the metal that's actually holding this particular model up is within what is called the vertebral canal. And to ask about that on a practical, I would stick a little pipe stem cleaner up through the vertebral canal. Okay. Also, when the spine is articulated, we can see some of those articulations. Okay, so go down here to the lumbar. This, as we'll see, is the body of a vertebra, body of another vertebra, and separating those two, we have an intervertebral disc, a fibrocartilage disc that is very squishy and essentially is a shock absorber. What we can also see when the spine is articulated is that there are little holes in between the vertebrae, and this would be anywhere. All right, so here is spinous process, the body, and this right here is a hole through which the spinal nerves are going to exit the spinal cord and come out to the rest of the body.